Show Me the Evidence traveled to Pennsylvania to see what people there think about evidence. Meet our interviewees. John is a stonemason and a bird expert. Mary is a healthcare worker with a diagnosis of chilblains. Darren is a stay-at-home dad, a father of 2 young children. Wayne is an engineer with a strong religious background. Nancy is a grandmother and a victim of childhood polio. What is the difference between an opinion and evidence?
The difference between opinion and evidence is that there are facts to support evidence.
Evidence is backed up by scientific data.
Evidence is based on science, on fact.
Evidence is supported by numbers.
Evidence is fact, opinion is just what you think of something.
An opinion is just something you form in your own mind from your own ideas and life experiences, I guess.
Well, I think an opinion is based on your own personal experience.
Opinion is just how you interpret those things or interpret your own feelings about something.
Tell me if you think the following phrases are an opinion or evidence. You should get the flu shot because it works.
That's an opinion.
I think opinion.
I would say that's an opinion.
That's an opinion.
Opinion.
The best treatment for localized prostate cancer is surgery.
That's an opinion.
I think that could be an opinion also.
Also another opinion.
I think it's an opinion.
No evidence.
1% of patients who took statins had a heart attack versus 2% of patients who took a placebo pill.
That's evidence-based.
Sounds like evidence.
It sounds like evidence to me.
Evidence?
The evidence, yeah.
There's
Yeah.
a wasp up
That's
there.
right, you're right. Hopefully it doesn't get in the video, okay?
Why do you think that last phrase is evidence?
They apparently did test on it and have a percentage.
You had percentages and there was scientific data that supported whatever it was you said.
Do you ever ask your doctor for evidence?
I haven't ever asked for evidence.
I don't ask my individual doctors for evidence very much.
Oh boy. No, I don't think I ever have asked for evidence.
No, I don't ask the doctor for evidence.
When I go see my doctor, I ask for evidence.
When you do ask your doctor for evidence, do they give it to you?
They do not specifically give me evidence. They tend to just tell me that they've had a lot of success with it.
Why don't you ask your doctor for evidence?
Because I have no reason not to trust them.
I don't know that they would have it.
I trust their opinion. They have done an excellent job working with me.
Sometimes evidence is acquired by myself in other formats, such as the internet.
Do you use evidence outside of healthcare? Some examples of this are reading and interpreting Amazon reviews, consumer reports, E-Trade, and many more.
I absolutely do use evidence in making decisions.
I often use evidence to find the best product.
Almost all the time we use evidence, and I use evidence before I do anything else.
Oh yes, I do a lot of searching for evidence.
I don't necessarily trust the reviews. Pretty much I decide for myself.
Does your doctor use evidence to pick the best therapy for you?
I don't know if my doctors are using evidence or not. I have no way of knowing.
I'm assuming that my doctor would use evidence in prescribing treatment for me.
I think my doctor uses experience and then evidence.
I kind of think they might, but I don't necessarily know that they're up to date.
Oh yes, I hope my doctor does do a lot of searching for evidence.
How do you know that your doctor uses evidence?
I don't know that he uses evidence in his decisions.
I really don't know if he does it, but I know that the overall effect is that I get better.
I feel like I can tell if they're talking about recent studies, or they're willing to change, to say, this was true, but now we're thinking this. And
I do not know that my doctor uses evidence. Shady. Where are we going with this, Aaron?
If your doctor isn't using evidence, what are they relying on?
just their past experience.
Book knowledge is background evidence. He sometimes talks with colleagues about treatments and things.
And some of them I think rely on even religious things, when it's about birth control or about other things.
Would you use evidence yourself?
I think I would probably rely more on my doctor.
I would absolutely use evidence.
I mean, I would want to have a doctor that I felt was up to date on the newest things.
Do you think you can understand medical evidence?
I do have some background in healthcare, and I still think it would be difficult for me to sort through the terminology.
Yeah, I feel like I could.
Yes, I can understand the evidence if I talk with them.
It's just a matter of someone explaining it to you or finding the right people to explain it to you.
I don't have the background and the access to the information that he would have.
We are going to take a quick break and have some of our interviewees watch some of our videos in the Show Me the Evidence series. These videos are designed to explain what medical evidence is and how this data is used to make informed healthcare decisions. Has anything changed after viewing one or more of these videos?
I felt it was very enlightening. I felt a little more comfortable about approaching the subject.
It really let me understand that I'm not maybe been taking the right path to look at this evidence.
You know, I've had some kind of life-threatening disease, and he, you know, I went for treatment and it wasn't responding to what he was telling me or something like that. Maybe I would feel differently.
I might not be getting all the evidence clearly, and I think in the future we'll be using this to make sure that we're able to read what the doctor's trying to show us.